I considered becoming a rural physician more than I ever thought I would because of the RSPP program.
Well, one of the delights I've had, directing RSPP is there is no medical student I've talked to that would say they didn't enjoy the RSPP. So that's a fun type of program to direct. So.
I chose to do the RSPP program for several different reasons. I had heard from people that were currently in the program at the time and from people who had already gone through the program that it was very good for independent learning in terms of getting you in to see patients on your own, without a resident or another medical student watching over your shoulder. And it really has turned out to be everything that I was told it was.
One thing that I really enjoyed is that, when you go around in the hospital, everybody kind of knows you, and you get a smile from everybody, you get a hi from everybody, whereas being in a bigger, hospital, you don't tend to know everyone.
Like she said, you know everyone at the hospital, but that also goes with the patients too, because you'll see patients in your outpatient clinic that you might end up seeing at the hospital or vice versa, and that's something I didn't really appreciate before going into the program, but once I got there it became very obvious that it was something that meant a lot to me. To see a patient in the hospital and you work them up and you do an H&P and you help them out, but then a couple weeks later you see them for their follow-up visit back at the clinic, and just to see how much better they are, whether it was a breathing issue, now their lungs are clear, or maybe it was a bleeding issue and now the bleeding has stopped, and it was very, not only educational, but very rewarding to see that you helped someone to feel better, and then you get to see them again and talk about how much better they do feel. It just makes you feel like you're doing good stuff, and it motivates you to keep trying hard.
I think too, being the only medical student in a small hospital is very beneficial, because the staff themselves are very excited about having a student, so you get to learn a lot more one-on-one. They take the time to point out anatomy, say on an ultrasound or a chest x-ray, that you normally wouldn't get, and it's just by repetition that you learn and retain things.
One of the things that I like most about this program is that you make the program what it is that you want. You get what you put into it. I remember when I was here doing the just general track, that I'd be yearning just to do a single procedure, and when I got to my rural area, I was thrown procedures almost, there's something here going on and you can go there and do that, or come over here and do this, and it was, there was never a drought of anything cool to see.
The goals of the program tend to be towards primary care or rural medicine, but I think the experience bears out that many different interests can be nurtured in the RSPP, either surgery, obstetrics, family medicine, pediatrics, or med-peds.
And I think that's important too, because not only is a primary care physician needed in rural areas, but oftentimes, in the area that I'm from right now, they only have one full-time surgeon. They have to hire a Peoria surgical group to come in and help them out right now at this point. So it's not like they only need primary care physicians. They need physicians in all different fields.
Working directly with an attending physician has been unbelievably helpful, because at the bigger institutions like here at OSF Hospital, which provides a great education as well, you're mainly with residents and other medical students, and so they have lots of clinical knowledge and skills, but they haven't had that 3, 5, 10, maybe even 20, 30 years of clinical practice where they have developed their own little tips and their own little methods of dealing with things. And when you work directly with the attending physicians, you get to benefit on that, and you get to reap the benefits of their 30+ years of clinical experience that gets showered down onto you.
I just want to say it's a privilege to be in this program, and I want to thank Dr. Barnett for giving us this privilege.
You're welcome. It's a privilege to be here working with us.
So you better cut before everybody starts crying.
Yeah.